Also breaking tonight after mounting public outcry, an unprecedented health care move is no more. Anthem Blue Cross Blue Shield announced that it will not be enforcing a plan to limit coverage for anesthesia during surgery. We want to thank you for joining us here tonight at 6. I'm Sharon Chen.
And I'm Zach Summers. The policy would have impacted Missouri, New York, and Connecticut, and it would have denied claims for anesthesia surgeries that exceed specific time limits. Doctors across the country were made aware of the potential decision months ago. The company determined how long a surgery should last based on industry standards and formulas set by the American Society of Anesthesiologists. But even the American Society of Anesthesiologists called the plan egregious and uninformed.
KCTV5's Joe Hennessy joins us now live from downtown Kansas City. And Joe, you spoke with a doctor before this update was released. So what were his feelings prior to that, and what are they now?
Well, they were concerned that an already stressful situation inside of operating rooms would be heightened with a timer ticking for the quality of care that they could provide.
Things happen. You can have bleeding, you can have unusual anatomy, and no two surgeries are exactly the same.
That was the concern from the start as the Anthem Blue Cross Blue Shield policy was initially unveiled for its customers. An arbitrary time that they would decide is the right amount of time for a surgery, capping the amount they would pay for the anesthesia costs.
Our preliminary evidence is that they do not meet reality in the operating room. Most patients don't know about it. We have been working extensively with Anthem in the past 4 weeks to try and explain to them the folly of their ways.
After weeks of battling over patient care, the Association of Anesthesiologists are breathing a sigh of relief, as questions like these, before the announcement was official, won't happen now.
Do you think that patients are going to turn away from getting a surgery?
They may. That's a very big concern.
Missouri's Majority Floor Leader John Patterson's response to the decision to do away with this policy is, quote, "The correct amount of time for an operation will always be the time it takes to do it right and do it safely." Anthem's public relations director, Emily Snooks, emphasized the decision to eliminate this policy in 3 states is that it was never their policy to not pay for medically necessary anesthesia services.
If there's fraud, we are all for trying to eliminate that. But this really looks like they're putting profits over patient care.
This started today with Connecticut being taken off the list at around noon. We interviewed Dr. Jim Kelly around 12:30, and then only took about 2.5 more hours for the state of Missouri and New York to follow. Reporting live, Joe Hennessy, KCTV5 News.
I'm sure this is an issue a lot of people will be paying close attention to. Thank you so much, Joe.